Is Singapore sometimes seen as a stepping stone to a greener pasture?
The Singapore healthcare training is valuable. So they're coming to Singapore and say, hey, thank you so much for training there.
Okay, so I put 5 years experience on my resume, I'll be snapped up like that. Hey guys, it's Steven here, and welcome back to Heart of the Matter. Now, I think it's safe to say that if you had to stay in a hospital, even for a short period of time, good nurses make all the difference. These nurses are technically proficient, they know exactly what to say to ease your anxieties, which is why there's been a lot of news about making sure Singapore has enough nurses to support its growing healthcare needs. Now, COVID-19 was pretty hard in this group. The number of resignations for foreign nurses almost doubled. The attrition rate was close to 15% last year. Things have since stabilised, but the hunt for experienced nurses continues. And the Singapore government has been rolling out plans too. Increasing salaries, throwing in attractive sign-on bonuses, providing hostel-type accommodation. But the challenges still remain. After all, a good nurse is highly sought after anywhere in the world. With a plan to add 4,000 new nurses by the end of this year, 60% of them foreigners, are these incentives enough? What are the challenges Singapore faces, and how can we keep them here? For this discussion today, I have with me Senior Parliamentary Secretary for Health Mdm Rahayu Mahzam.
Hi, Steven.
Group Chief Nurse of the National Healthcare Group, Yong, Keng, Kwang.
Hi, Steven. Glad to be here.
People360 Services, that's a healthcare recruitment agency. We have the CEO and founder, Jordache Keith.
Thanks, Steven, for having us.
All right, great to have you all here. Rahayu, I'm going to start with you because Singapore's health minister said in July that the attrition rate for nurses has gone back to pre-COVID levels. So it actually sounds like the situation is under control. Why then are we looking to add another 4,000 nurses by the end of this year?
That's our target for this year, but actually we are growing the workforce of nurses and support care staff from the 49,000 at end of 2022 to about 69,000 by 2030. And really because we are an aging population and our needs are such that we do need our healthcare system to grow. Nurses form a very important backbone of the healthcare system, and we need to bring in enough numbers to prepare for this growth in the healthcare sector. So this is inevitable, and we're doing all sorts, as you mentioned earlier, multi-pronged approach to try and bring in more nurses. We are looking to build a strong local core of nurses complemented by valuable foreign workforce.
Okay, so in other words, we see a real need in actual numbers of nurses. I mean, King Kwang, maybe you can shed more light on this because you're the chief nurse for the National Healthcare Group. So you're on the ground, you're seeing this happen in the hospitals all the time. How bad is our situation here?
2 years ago, we're not that good.
Okay.
But this year onwards, or the end of last year, because the numbers are coming in, we're good for now. But like SPS mentioned, we're really preparing for the future. So we do have quite a number of new nurses at this time, which we are trying to make sure that we have a time to transit them to our local practice. I would say better than 2 years ago.
Okay, we're okay now, but we anticipate there will be a greater need and we are preparing for that.
Yes, and that is something that we've always been on our toes for. So to make sure that we're not complacent about this.
I guess the key thing also that we've been seeing, and King Kong can attest to this, is the fact that the profession is tough. It's challenging when you don't have enough people. So all the things that we want to do in providing better well-being support, and providing for a better working arrangement is tough to do if you don't really have the basic ingredient, which is manpower. So it's key for us to size it right, make sure that we have enough people so that we can continue making the profession a good place to go and continue to have sustainability.
But at the same time, we realize that we literally don't have enough nurses within our own population, right? So we have to turn to those who come from overseas. So do we have to accept that foreign nurses will always be a part of our ecosystem?
Yes, that's a reality you have to accept.
I believe so.
Yeah, Jordache, I mean, you bring in, many of these nurses, yeah.
Nurses has always been a limited resource. Many of my friends, my personal network, they want to go into, I would say, the sexier jobs, right? Like, for example, banking, AI, tech, right? So I think, again, the nursing profession is a profession of heart. Right. You need to have passion to stay on into nursing. You can't sustain by just pure monetary benefits. You need passion to stay on with this job. So I think to begin with, we already had a lack of nurses. I mean, we've coupled with this growing demand from the aged care services. Our population, 1/4 of them are going to be 65 years old and above in 2030.
Yep.
Right. So that created a whole demand of health services, the need for GPs, the need of doctors, the need of nursing homes and elder care homes. The supply does not meet the demand.
Okay.
And that is why we have to look outwards. We have to look at, I think, the regional source countries so that it has a healthier pool of nurses. I mean, one of the countries is Philippines.
Yeah. In fact, you bring in from the Philippines, India, Myanmar, Malaysia, and Thailand, right?
Correct. So it's regional Southeast Asia.
So okay, we accept the fact that we will need them to support, our country. So the question is Singapore a popular choice for these foreign nurses?
I think it's subjective. Ultimately, it depends on what the nurses want. I mean, if proximity is something that is close to them, family ties are something that they want to go back and forth, frequently, then Singapore is a choice country.
But if I put you on the spot here, on a list of like the top 5, does Singapore rank in there,
To be honest, I think we are a popular choice. In Asia, we are probably the top choice. Right? But when you're comparing ourselves to the Western world, there are certain perks and benefits. For example, they're providing permanent residencies. They're allowing their dependents to come along with them. Free education for even their children. So it's hard for us to compete on that scale. I think, again, it's not apple for apple.
Okay.
We are also limited in terms of land size and the amount of kind of permanent residencies we can give because of our sheer small size. I think in Asia, I would say yes, Singapore is the popular choice, but globally, are we as competitive as other nations? No.
So Rahayu, you hear that and
We know this, and I just wanted to add another dimension to this, that we are a small country with a limited demography. So in all sectors, actually, not just in healthcare, we need to be augmented with a good foreign workforce. And that actually means we are in competition as well. There's global competition everywhere. And we hear it loud and clear that some of the offerings by other places are more attractive. And so that's why we are working very hard. Like MOHH has been going out there, really also starting early. We are working to try and get foreign students to study in Singapore. And so that when they come out, they will be working here. We are looking at those who are graduates from overseas to also come here. And the package then needs to be attractive. We're also working with the clusters. The clusters also do direct hires, and they also try and add on and make it attractive. So the common things that's spoken of in terms of the not just salaries, but the experience here, whether they can bring their families, what other perks they have for education for their kids and all that. And that's not always so straightforward to do, because we are also talking about one sector. There are many other sectors in Singapore. So we do need to figure that out, how best place we are to encourage that. But those who are committed to stay here on long-term basis, we do encourage them to take up permanent residency, and the hospitals and the classes support those applications. So I think it's something we have to continue to do on one part, but I think community, society, people also need to be kinder and be receptive to this. And hence and this is a larger issue, of really how we are accepting and welcoming of people who are from a foreign land but are working together alongside fellow Singaporeans. How that culture is built within the clusters, within the community. I think that's important too, because like you rightly pointed out, it's that feel, right? When they come here, all that experience that they get. So I think that's something that we need to think about.
Yeah. So actually, you've raised quite a few things. I mean, it's the infrastructure, the money, the nice package that you give. That is one thing, but also the work environment. I guess if they're in the hospitals and people are shouting at them all the time, then after a while they're just going to leave regardless, right? But we can't change in a way. It's very hard to change behavior, right? And is our culture at the point now where you feel the nurses, where they're working, the environment is at the right spot for them to say, I enjoy working here, I want to work here, the package is an added bonus?
Maybe I'll start with Jordache's comment. You put him on the spot on whether we are the top 5.
Yeah.
If you ask from my perspective, I think we are about top 5. Maybe 5 to 10. I generally find that our foreign colleagues, they do find a gratification here. They do find satisfaction. And the fact that their family can be nearby and they can fly home, for some of them it works. They like the fact that we are we are very a tolerant country in terms of multicultural traditions and the way we work with one another, the way we talk to one another. So it fits in, the food-wise, it fits in. And we do provide a lot of training opportunities.
Okay, but what about the way we treat the nurses? Because I gotta say, sometimes we're not, as Singaporeans, we're not so great in our people skills sometimes.
We're not so great in our people skills, but I think we are getting better because the population in general are getting better in terms of more sensitive to the needs of interacting with people. But the one thing I realize about whether it's nurses or healthcare workers is that they understand that sometimes the patients are not the most reasonable for the family. They understand it comes with a job. But what they want really is that when something like that happened to them, that the organization is behind them. And I think over the years, maybe 20 years ago, we're not as good. But in recent years, we're very sensitive to such matters. We took care of them. Whenever such incidents happen, our response are fast. And so I think in general, they do sense feel protected. Okay. Even if the patients or the family are the perpetrators, they know that the organization is behind. And that's what's the most important.
There's actually a work stream on that. And Keng is also involved with that as well. It's the tripartite work group on the prevention of abuse and harassment against healthcare workers. And we've been working very closely with the different clusters, the nurses and the healthcare workers to really understand what are some of the experiences and what is the solutions that we can come and take forth. So there had been very candid sharing. We had quite an extensive outreach to hear their stories. And really, like Keng pointed out, they are very tolerant, In fact, some of these things they don't even consider as harassment or abuse because it's such a part of their jobs, which in itself is an issue.
I don't know if that's good or bad,
Yes,
so now there is an appreciation of that, and one of the efforts really is a standardized procedure for which then they can actually do a complaint, and we can actually have organizations and clusters backing them up on this. So there is a zero tolerance policy that we're working on, and I hope some of these things actually create for a better workspace. Another aspect is there was a staff wellbeing committee set up in 2019, and there were some ideas as to how we can make the workplace
But all these things will always be there. I mean, policy is nice to have, and it exists there on paper, but I guess I'm coming also from, for a long time, the Asian perspective, where sometimes we tend to not look at nurses as a professional role.
So as part of that effort also is public education, because for example in some other countries, right, in a nurse here is expected to do all the other things like cleaning up, feeding and all that, which are actually not some things nurses in other places do. Correct. Because they are mostly focused on the clinical aspects of things. So those things are things we need to educate public about and have them appreciate that the nurses also have a lot of other things to do, and also caregivers work together with caregivers to actually change those dynamics. There is a change. There is a shift in public's perception.
But when the nurse is also cleaning up after the patient, I guess you sometimes don't take them as seriously, because to the family you may say, oh, she's the one cleaning, but the medical is only from the doctor, right? There is that perception.
I do see change.
Is this something that we can change? I mean, is this why are our nurses then, I mean, Jordache, maybe you can also chime in other parts of the world, you're saying they don't do such jobs.
Correct. So, for example, when we go through the job scope of a nurse in Singapore, I think what happens in Singapore is that we have a very interdisciplinary team where you get a nursing aide, a healthcare attendant, an enrolled nurse and a staff nurse working as a team, right? So at times where if one person is busy and engaged on another call, I mean, I'm not a nurse by profession, this is what they share with me, right? So they have to step up to do duties. For example, in other countries, as a staff nurse, you do not do the ADLs, which is the assisted daily living, like showering of patients, and all. But in Singapore, you're required to do.
Is it because of a manpower crunch? We don't have enough people?
I think the way that we always operate in Singapore is that we operate in efficiency. We try to keep things lean. That is my perspective of things. Of course, we also do not have the liberty of having such a big natural workforce in Singapore where we can have job creations for and have so many staff.
Because the nurse who has worked in that environment will then look at Singapore and go, you mean I have to do this for this job? And they may not want to come here because of that, right?
And that's when we have to manage the expectations during the interview stage. Like, hey, this is the job scope, right? You got to be ready for it when you come to Singapore, because there is a cultural change, a workplace cultural change. That is when we then sift out the applicants, who is ready for this job and who is not in Singapore.
So we are a bit unique in that respect.
I feel that our nurses really go above and beyond.
Correct.
I don't think they, like I said earlier, when we talk about harassment and abuse, right? To them, it's part of the job. Some of these things, even if you don't tell them that it's part of the job scope, they will do it because they care so much for the patients. And then we've kind of being taken that for granted. And so I really feel that we really should strengthen our public education. And I mean, sessions like this, I think, is so useful to have us talk about this openly and have people be aware that some of the things that we are asking of nurses are really beyond what they are expected to do. We don't want to unnecessarily change that dynamics, because I think we do want to encourage nurses to give their best and care for their patients, but we do need people to be reasonable.
Yeah, I mean, if I can point out, Steven, what you point out is really true, is the hard truth. But where I was trained in UK. When we were trained, we see it as a pride to be involved in the complete holistic management of the patients, including private moments, in vulnerable moments where they have to expose their private parts to us. Yes, we take it, some will see it as a dirty job, you clean after somebody. But from nursing, when the way we are trained, we're trained to say that this special space, this personal space, is not easy to get in. And when you're in, take it as a privilege. You have to manage the most vulnerable moments of a patient. So I do understand in some countries in Asia especially, they have support, and their support is in the form of family. Right. But they also know that when there's no family that comes into the patient, the nurses will do everything. So Jordache is right. You do have to point it out to them. But if for many of these nurses who want to end up in the Western countries, you do everything for them because we view it as holistic care. And so like what SPS say, we are trained to give our best to the patients. And so if we don't look too much into this, there's really a value in holistic nursing. But you're right, we need to manage the expectations of the foreigners.
So it's not for everyone.
But they also know that where they come from versus what we have here, our manpower status is better in terms of providing care for our patients. Where they come from, they have to manage a whole load of patients. And that's why they really have no time to do complete nursing. In a way, there's not much gratification because they're just moving from one patient to another patient doing tasks. I'm just giving medications and then I'm moving. The interaction times are all reduced. So for them, when there's an opportunity to try somebody somewhere else, they do go for it. They may talk about the fact that I don't do all the cleaning up when I was there because the patient's family will do it.
But we don't necessarily want to take the essence and spirit of the
nursing
kind
profession
of nursing that is present here in Singapore, which is really top notch. Which is why our healthcare system is also good. So it's just that people need to also understand that we need to respect each other. We need to understand that this is something they really go beyond their call of duty and create that environment of respect. So I think when we were also in discussions about rest times for nurses and all that, the practical reality is that on the ground, these nurses, they really think about the patients first. You want to tell them, okay, break is this time. They will still think about, okay, has my patient been sorted out? If there's an emergency, there they go. So we need to appreciate that the ground is different and we want to continue to encourage that sense of empowerment on the nurses' part, but we do need the whole of society to give and take so that there is a better working environment.
It sounds like we have the infrastructure. We can have all the modern facilities, the nice hospitals, but at the end of it, if the people who work with them, do not respect them the same way, then it creates this culture which is very hard for any of us, I think, in any profession to continue working in the long term. So let's move on and talk about what do we need to do to help retain these nurses. You've mentioned a lot about the passion, but also throwing in support for accommodation because the cost of living is going up. I mean, Jordache, what would be the more important of the two now in terms of bringing in new nurses into Singapore?
I think there are two moving factors, right? Attraction of nurses is one, and then retention is another. Retention starts from the attraction. Is the way how you treat them, what is the kind of experience they feel upon coming into the system, how do we settle them in, how is their orientation program.
Do we have a nice orientation package for them? Do they come in?
Yes.
It's true because the first impression does leave a lasting impression, right?
Psychologically settles them into their job. We are setting them up for success, right, while they are working. And I think the nursing profession. A lot of our government hospitals have a very nice induction. As new nurses, they come in and they've served their 6 months probationary period. And during these 6 months, I think they have preceptors that buddy with them.
When you have nurses who leave, why do they leave? What do they tell you is the reason for them leaving?
Multiple reasons. Some of them want to rejoin their families. They want to go back home. They miss home, right? They spend 10, 15 years here, and it's time for them to go home because they miss their children.
Okay.
I think some of them are progressing with their careers, right? They want different overseas experiences, right? Because they want to travel to perhaps to the Western world or hey, let me try something new.
Is Singapore sometimes seen as a stepping stone to a greener pasture? Yeah.
That is, I think, a pretty known fact.
Okay.
That the Singapore healthcare training is valuable and is sought after across the world. And that is what is happening now, because instead of the Western worlds hiring them from the point of origin, from Southeast Asia, everyone is trying to find diverse source, everyone is trying to find for new fields.
Okay.
So they're coming to Singapore and say, hey, thank you so much for training there.
Okay, so I put 5 years experience on my resume, I'll be snapped up like that. So this is Rahayu's problem.
So we've heard this, and we are clearly bothered by this effort, because we work so hard, right, in providing the training, and then when they're well trained, it's it's a loss to us. So but we do have to appreciate the realities and the challenges we spoke about earlier of why people want to leave, and so address those. One key thing, at the end of the day, although we say, okay, money is just one part of it, but I think it's important to structure that properly, because people need to be acknowledged and remunerated. So we are thinking about and working on retention benefits for nurses, a long-term scheme that hopefully will continue to encourage them to just want to stay in the profession. And as I mentioned earlier, the pain points that the nurses have highlighted, we are trying to address those in terms of abuse and harassment, in terms of their well-being. We're using technology to augment some of the jobs. We've learned from COVID-19 and through the introduction of some of the patient care assistance, that would be one aspect of the work that could be augmented and supported. So we're looking and trying to pilot some support and continuing some of the support there. So there are many different dimensions of the work that we're looking at, and we're working very closely with the clusters to try and translate that to the grounds.
Yeah, just want to add, since the start of my career 27 years ago, oh gosh, I have to say that. We already had foreign nurses back then, and I've worked with them. And back then, we already know they will leave for the Western countries. So it's been like that for 20 over years. Back then, they will leave for family reasons. They will leave for monetary reasons. Today, if you spot any of them leaving, most of them will not tell you it's because of the money, because we are doing well with money. Right? They will still cite the fact that it's associated with family, and the fact that they want to travel the world and see what it is. They won't cite reasons, even back then in 20 years ago, that they want to go overseas for professional development, because the opportunities for professional development in Singapore is equally good. Yeah. So we do know some of these factors, and I'm glad that together with the ministry, we're starting to address them one by one. And one of the most marked changes that we've done over the last recent years especially is in terms of the remuneration package. So we're doing pretty well there. We're reducing the need for them to move overseas. The push factors, we're reducing it. But one thing remains, and that is the family thing, especially after COVID.
So is that something we can look at? So we've got the infrastructure, the career path is quite clear, remuneration seems okay. Can we bring the family to be with them? Because everybody wants to be with their family, right?
It's a dimension we're looking at, of course. We're taking a very holistic approach to the things, and we are addressing each pain point.
And the cost of living, because Singapore has become increasingly expensive. And if we talk about our friends who come from our neighbouring countries, it's quite a big jump to move to Singapore.
It is quite a big jump, and we will have to confront that problem together with them. But interestingly, I have a Malaysian colleague who recently was part of a recruitment drive that we did together with him. And he would say things like, it's quite expensive in Singapore, but if you manage your finances well, in this case, he can send money home, and he's even buying property at home. So it's not impossible.
Correct. And lifestyle choices Again,
Yes.
subjective to how you want to live your life. So same thing, certain nurses here, when we bring in the nurses, we do inform them on certain choices of food options, like having their meals at hawker centers. We're not depriving them of going to restaurants, but we give them a whole suite of options that,
Okay.
if you want to live a extravagant lifestyle, then of course your savings are going to be impacted. But there are reasonable prices, and again, like me being a Singaporean, I don't eat at restaurants every day. In terms of helping these foreign nurses to come in, I think the majority of the employers here, the hospitals, have been very supportive. They have been giving them relocation allowances to help them settle in when they're first coming into Singapore. Of course, I think house rentals have been significantly high.
That is something new that they're trying out, right? To provide some short-term
correct.
accommodation at the beginning.
Yeah.
And that is, I think, the true pain point, is that as a nurse, their first question is, if I'm going to pay for my rental beyond my allowances, how much more do I have to dig into my basic salaries? And I think that's one of the pushbacks of when we are speaking to nurses of why to come to Singapore. They say, hey, rentals are expensive, and this is something that is a stress point for them.
Okay, so this is something that is also being looked into, I imagine, right? Because imagine if half of your salary goes to rental every month, you'd be like, whoa,
So we announced recently about converting a space into hostel for the nurses, and we're trying to make that arrangement so that will definitely address the particular issue of housing.
In 2024 Q4, that's when they're going to repurpose certain sites to house nurses, right? So it's a great move.
We're planning for the future, but we can only anticipate that as time progresses, we will need more nurses, and not just in the hospital, but in fact in step-down care as well, in the community hospitals, right? What are some of the other areas we need to look at? What do you think would be key on the horizon that we should be also looking at for the immediate future, and the concerns perhaps that you would have in this sector?
It is to have a sustainable pipeline, and I think we do that at different levels. So firstly, I think elevating the profession, actually promoting it and explaining the work that they do. I think COVID-19 has helped us kind of showcase the good work of healthcare workers, in particular nurses. So that's one dimension we need to look at. But we also need to look at all the different sources. So locally, we've not dropped the ball on that either. So we're still continuing to work with our schools to do the talks, in the school, encourage them to come into nursing, making sure they don't also leak, making sure they continue to stay by actually exposing them to work in the public healthcare sectors, and then encouraging them with the very attractive sign-on bonuses. Then when they are in, make the work environment comfortable, and retain them through many different benefits, including salary. So I think it's an ongoing effort through different forms. We're also getting sources from different levels, including mid-career converts who really want to change professions. So we are making it easy for nurses to come from different platforms. And these are the various efforts that we're looking at to try and continue sustained growth in this sector.
Correct. Yeah, we got the RTN program, your return to nursing,
that's right.
for those who left the profession, like
come
moms.
back.
Oh,
Right?
okay.
Return back into the profession. Yeah.
Okay. So they would just need a bit of a refresher course,
course,
and they
yeah.
come back. King Kwang, what keeps you awake at night? With regards to the
Well,
hospitals.
I'm still worried about manpower.
Yeah.
We have to start exploring different sources other than Philippines and India.
Correct.
But Jordache has been to Thailand, so we have to make sure that they can assimilate. So manpower does keep me awake at night. We know that in terms of professional opportunities to develop themselves, while we have them, we need to provide more because there are more and more nurses. So the current resources for career development opportunities will also have to be sized up accordingly to manage that. We do have issues about making sure that people do have a chance to rest during shifts. Like SPS mentioned, we have nurses who just won't want to go on break, even if we make them. So in order to assure them that we will size up the resources properly, to assure them that, hey, somebody is watching out for you.
Yeah.
So you can go for a break. So these are the issues that we'll continue to work on. Yeah.
Okay. If you could change something tomorrow, you had unlimited budget and resources. It's a dream, but what would you like to change? Jordache, what would you do?
Manpower will always be a challenge. I think with our low birth rates here in Singapore, I think maybe the adoption of AI into nursing, right? That is something that we could adopt much faster. I think also what I feel is probably job restructuring, right? Looking at what can we do away and what is core for the nurse, right? Which is truly patient care. Is there administration duties that can be done away with automation?
Okay.
Right? That's something that will really relieve them, right? And they can focus on what they do best, which is caring for patients.
For me, my wish is not fiscally inclined. I'm wishing for a community and society that is responsible and respectful, that allows for different professions to thrive, especially nursing. And I'm hoping for that mindset shift in our community, to be accepting of people from foreign land who come to work and support us, and also be respectful of people who do different jobs. It's only if we can create that culture in our country that we can then thrive, because people won't want to come if we are a country that is constantly in angst and very nasty to one another. But if it is a country that is full of support, respectful, and everybody doing their part, I think that will bode well for Singapore.
Agree.
Only one thing.
Just for now, yeah.
It's related to what you say, right? No matter how we pitch nursing as, people will always remember that nursing has to clean up after a patient. So my wish is for more opportunities to showcase the value of nursing. And so if we have more opportunities to show that the nurses can make a lot of decisions at the bedside. For example, we are working on the clinical guidelines, the clinical scope of practice, where they can even prescribe medications, which is now done with the APNs. We are hoping that you could go down the chain a bit more to some of our more senior experienced nurses who are not APNs, investigations, and then be more involved in consulting and working with the patients directly, so that the patients can see that the nurses are also at the front end making the first response and the kind of decisions they need to make, and not always feel that they are being deferred to the doctors, and they see the doctors making the most glamorous decisions, and we end up doing all the cleaning work and then just follow the doctor's order. So my wish is that we'll definitely introduce more professional autonomy for the nurses to do more for the patients, which they are more than capable of today because of the training that we provide.
I think we've all been there, for when you've been in a hospital where your loved one is there, and when you have an experienced nurse, it is such a difference.
Yes.
Right. And you feel so much more reassured, confident that they will be able to support you and care for your loved one. So hopefully, your wishes will be granted. And that, I think if we can create this environment, first of all, where we truly respect this as a much higher calling, I think that is a good start. Well, thank you all for coming in, for giving us your time and sharing your insights, for all of you who have been listening in as well. If you have any views on this topic or any of the topics you've heard, feel free to drop us an email at cnapodcast@mediacorp.com.sg. Of course, leave us a review on Spotify or Apple Podcasts as well. The team behind this podcast is Jacqueline Chan, Joanne Chan, Tiffany Ang, Saya Win, Jesselyn Tan, and Crispina Robert. And I'm Steven Chia saying keep talking, keep connecting.